This video discusses the applications of ICTs in the field of medicine. So just like law enforcement, if you look at many different medical dramas and so on that's on TV right now, you would again be exposed to many different examples of how computers are used in this field. So first we have patient records. So many doctors' offices and even hospitals and so on still use manual database systems, basically physical paper files to store information about the patients, their diagnoses, their symptoms, a record of all their treatments, and so on. If all of this information were to be computerized, so the private doctors, the major hospitals in all of the different countries and so on, then we can have many different advantages. So for instance, if a patient comes in, there'll be reduced time spent looking for the record in the case of emergency. It makes it easier for trends in diseases to be detected because, again, the computer can analyze all of the information that is available. Additionally, if a patient had to be transferred to a different facility, then all of their health history, all of their medical history can be accessed very easily when they get to the other facility. Then we have patient monitoring systems. So computers actually control all of the equipment that monitor a patient's vital signs, such as blood pressure, temperature, heart rate, and so on. These are detected using sensors. So, for instance, if a person is very ill, they may be hooked up to all of these different sensors, and the recordings or the readings would be recorded for the doctor to come in and examine. Also, if something is going wrong and their temperature is dropping or heart rate is dropping, there may even be an alert so the doctors and nurses can come in. Computer-aided detection and computer-aided diagnosis. So we have MRI or magnetic resonance imaging, which actually uses magnets to create 2D and 3D images of various tissues in the humans and can actually detect things like tumors, for instance. So many people are getting cancer these days. So it's a very important piece of machinery, and again, computer controlled. Or then we have a CAT scan or computer axial tomography. So this is basically an X-ray machine that can take many pictures. A computer system then uses all of these still images to reconstruct a 3D view of the patient. Again, the CAT scans can also be used to diagnose diseases. Here we have the expert medical system. So we talked about expert systems before, and these give some advantages and disadvantages of expert medical systems in particular. So remember that it's still a machine, it's still a computer, and it can't really include instincts and common sense that humans can use as part of decision making. It also cannot learn from its mistakes, unlike a real doctor. Despite these disadvantages, it can support a doctor who is doubtful because of their decision, and it can arrive at a conclusion faster and may even be more accurate because of the expert knowledge that it contains. Then we have something that's could be a little bit controversial, practicing medicine via the internet. Now, if doctors use the internet to send information to patients via email, to send information like x-rays to other institutions for research, or even this really interesting one, collaborate on surgery in real time, that's all well and good. But this last sentence here with doctors diagnosing illnesses and prescribing medicine online, you have to be a little bit careful there because a doctor really has to examine the patient in person to make a proper diagnosis and to be able to prescribe medicine. Because so many of our medical facilities equipment would be run with computers, they have to be very careful if electricity goes. So, for instance, the patient monitoring systems. How can the patient be monitored if the computers are not working? So it can even be a life or death situation. So there are many advantages of computers in this field of medicine. It can save many lives, for instance, through the use of computer-aided detection, computer-aided diagnosis. It makes things very convenient for patients as well as doctors, but you also have some disadvantages as well.